Hi, I'm Dr. David Stoker, board-certified plastic surgeon in Los Angeles and mommy makeover expert. So what I want to do is focus on a few key things about a mommy makeover. I receive a lot of questions and inquiries from patients about what is the recovery like after a mommy makeover and what are the key things to know on your recovery. First of all, mommy makeover is a big operation. Typically, a mom also has kids at home. She may have work responsibilities as well. So I recommend from a practical perspective to try to get some help at home, whether it's your relatives, whether it's a nanny helping out, whether it's a husband who can, or a partner who can work less. I think it's really key to relieve you of a lot of the work and stress at home. The second thing is in thinking about the healing. The abdominoplasty is the core procedure. Frequently we combine that with a pubic lift. I'm typically removing 1 to 2 to 3 square feet of skin and full thickness fatty tissue and tightening up the abdominal muscles. It's a big operation. It makes a profound difference on the patients, but that's the key one to know how to recover from. So basically, when you lift up a large amount of skin, we pull it and then we stick it back down. We want it to heal. If the patient is twisting and turning and moving, it's like ripping off a scab every time they do that. We put in little drains on each side underneath the skin to suck out any fluid, cause that skin to stick down. We want to get those out as soon as possible. So we put a nice snug binder on the patient. We tell them to take it easy. We want them to putter around the house, get up to use the restroom, go to get something to eat, but don't be doing laps around the block proving that you're a superwoman after this. You want to focus on keeping your core still. If you're twisting, getting in and out of the car, taking the kids to school, that's no good in the first couple weeks after surgery. You want to keep your core nice and still. Pretend like you hurt your lumbar spine, threw out a disc or something back there. Keep your posture nice and upright with a tight binder, and you'll be rewarded with a quick recovery. Be sure to wash your hands frequently. The liposuction incisions are tiny. They're rarely any problem at all. Breast surgery varies. You're going to have tape on those incisions, whether it's an implant, a lift, or a reduction. You want to keep that nice and clean. I like to keep all the tape clean for approximately and dry for approximately 4 days after surgery. You can get into the shower and wash using a washcloth, but I don't want you to blast those incisions with water. Those are some of the key things to think about if you're going into a mommy makeover surgery. If you're flying in for that operation, we'd like you to be in town for at least 7 days. 10 is preferable in most cases. This is Dr. David Stoker, board-certified plastic surgeon in Los Angeles, explaining some of the key things to consider if you're about to undergo a mommy makeover.